Hello, Namaste, Jai Shri Krishna, Vanakkam to all the devotees and all the viewers of the DharmaSamvad. Today, we are into the very exciting and very important day, 2nd of October. When I say exciting, means that today we are inviting our guests. So all our guests are known as a Corona warriors. Corona warriors means that obviously when it's come to the warriors, so war, who goes in the front line to the win when it's come to the war? Soldiers. So our doctors, our medical staffs, they are the actually real soldiers when it's come to the fight with the corona. They are the frontliner. They are the first one who going to touch patient. They put them life at the risk. 2nd of October, we all of us know the 2nd of October is known as a Gandhi Jayanti and also Lal Bahadur Shastri Jayanti, birth of the two noble human life. As well as when we say Gandhi Jayanti, Bhagwan say Gandhi ji, Gandhi ji teach us. When I say Bhagwan means Mahatma, there is a one kind of the Atma, Atma and Mahatma. Mahatma, Mahan Atma, who sacrifice time, effort, dedication. Lal Bahadur Shastri has given us when it's come to when he was Prime Minister of the country of the India, he gave called the Naro. Naro means he gave a slogan, Jai Jawan, Jai Kishan. He has dedicated his presidency towards the Jawan means soldier, Kishan means farmer. Today, we are dedicating our show to our doctors. These doctors actually are, there is no word we can describe. When the real need in Gujarati, in Hindi, and every language, we say the second Bhagwan is a doctor. Where everything was closed, the doctors was the frontliners. Medical practitioners, they are the frontliners. And we know it's not easy. It's not easy to work in the circumstances like this. Why I'm saying? Think about it. If you as individuals, we as individuals, when we go to the workplace, every time there is a fear in our mind that we are, there is somebody will come, will have a virus. And we used to be receive phone calls every time. We used to receive the messages every time. when during the lockdown, every person who get the corona effect, the how the family go through. And I know the my few young doctors who actually started them journey in the medical field just now, a year or two. And they have to leave out from the house, means can live without family, and stay into the hospital, stay into the complex of the hospitals months and months. Last 3-4 months, I have seen many doctors. They have actually didn't come out from them services. It's not easy. Let us today celebrate our big day with our warriors, and without wasting too much time, we will introduce our guest. We will invite our guest, and they will actually share them experience. Okay, what is this actually virus itself, and what one should do, and how we can protect ourselves from our this difficult time. When I say difficult time, means emotional time, emotionally difficult time we everybody go through. So now Jitesh Bhai will be take over from me and will actually introduce each doctors. But before that, our Hindu customary always that we should pray. So today's my prayer is Om Sarve Bhavantu Sukhina, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kashit Dukhamat. Means ke Sarve Bhavantu Sukhina, may all will stay with happiness, may all stay with health, may all stay with joy. With that prayers, we going to start our show today. Health and happiness both are important. Bhagwan Sri Krishna, Bhagwan Sri Radha Krishna. Bless to the all viewers with good health and good happiness too. So Krishnaya Vasudevaya Haraye Paramatmane Pranata Kleshanashaya Govindaya Namo Nama Om Bhurbhuvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Nah Prachodhayato. So Jitesh Bhai, please take over and introduce our warriors, and we welcoming to all our viewers in this our weekly talk show.
Thank you, Gopal Bhai, for that brief introduction. Gopal Bhai Vyas, all the way from East London, right here on Jaiho Radio, as well as on our social media streams. So the corona pandemic has definitely turned the world upside down and has created a new normal in everyone's lives. To speak more on this topic, we have doctors from our community to share their experiences while serving the community during the pandemic, and also give us some medical advice regarding to this virus. So our guest for today is Dr. Amitabh Mitra. He is an accident and emergency professional at Cecilia Makiwane Hospital in Madansane. He's also an orthopedic surgeon and a gender violence expert, working in close collaboration with National Persecution Authority. We then also have Dr. Priya Durga. Her interest in medicine stemmed from her parents. Growing up around her mother's medical practice grew an interest into a passion. She is currently a second-year medical intern at Polosong Hospital, and she graduated at the University of Pretoria School of Medicine in 2018. Our next guest will be Dr. Anil Desai. He's always battle with this word. I'm sure he's going to help me out there. An anesthesiologist in a private practice in Johannesburg with special interest in vascular anesthesia, regional anesthesia, and advanced airway management. He was involved in providing anesthesia and post-op ICU management to COVID-19 cases recently, and he completed his undergraduate studies at the University of Pretoria and postgraduate studies Studies at the University of Witwatersrand. Our final guest today is Dr. Piasha Pillay. She's a general dentist practicing for 10 years in Port Elizabeth, qualified in 2009 at the University of Western Cape. She has a particular interest in treating children and breaking the stigma and fear attached to visiting the dentist. So let's hear a nice warm hello from our guests today, Dr. Amitabh Mitra. Dr. Hi, Dr. Priya Durga. How are you doing?
Namaste, I'm well, thanks, and you?
Fine, thank you. Dr. Piasha Pillay, how are you doing today?
Well, thanks, and you?
Fine, thank you. And we have Dr. Anil Desai on board as well. Welcome to Jai Ho Radio. How are you doing, sir?
I'm good. Thank you so much. Namaste and Jai Shri Krishna.
Namaste. I think we're still waiting for Dr. Amitabh Mitra, but I think we can still start. Dr. Anil Desai, we're going to start with you. So being involved in providing anesthesia and post-op ICU management to COVID-19 cases and also dealing in advanced airway management, what challenges did you experience and how were they overcome?
Okay, first of all, Jai Shri Krishna, namaste to everybody. Thank you so much for having me on to share my experiences with you all. Well, COVID-19 disease is a new disease caused by the novel SARS-2 coronavirus. Now, initially, as not as much was known about the disease, that in itself, posed a big challenge to us as the medical fraternity. We couldn't go to any textbooks or couldn't reference anything online to look for any information. We had to rely on the experiences of our colleagues in other countries who had already felt the impact of this disease. But every day, as the disease went on and on, we learned more and more. And by trial and error, and also under the guidance of a limited number of trials, we somehow managed to bring it under some measure of control here in our country, South Africa. Specifically in terms of anesthetic management and advanced airway management, the biggest challenge that presented to us as anesthetists and clinicians and patients working in the environment where COVID-19 patients were treated was that we wanted to limit our exposure to the disease so that we could manage our patients accordingly. As we all know, transmission of SARS coronavirus 2 can occur through indirect, direct, or close contact with infected people through infected secretions such as saliva and respiratory secretions, or thin respiratory droplets, which are expelled when an infected person coughs or sneezes, or even talks or sings. Now, respiratory droplets less than or equal to 5 micrometer in diameter are referred to aerosols. And anesthetists and surgeons working in a theater environment, clinicians, physicians working in the ICU environment that had to manage these airways were at risk because of these aerosol generating procedures. And that's why we all had to adhere to precautions such as protective equipment. And initially, that was a challenge, getting this equipment, procuring it, making sure that there was enough stock. But somehow, the environment in which I worked was readily resourced. We had all the equipment at hand, and we managed to overcome that initial fear dealing with these patients because we had the necessary equipment. In terms of advanced airway management as well, a lot of the patients that we treated were in severe respiratory disease, had to be intubated, had to go onto ventilators. And that process itself posed a risk to us. So we had to modify the traditional techniques, rely on modern technologies such as video laryngoscopy, and that actually helped us to manage the process without exposing ourselves to the disease.
Okay, so COVID-19 presented huge challenge to the global community, to South Africa's already poor healthcare system. So what are some of the key preparations that were met and were adequate to meet the demands of patients?
Yes, definitely. COVID-19 exposed the glaring inequalities of South Africa's healthcare. But I think what counted in our favor was that countries in the northern hemisphere experienced the pandemic first, and that gave us enough time to prepare. And although there's vast differences, that are available as resources to the government sector versus the private sector, I think government and private sector came together and managed quite well. So in terms of the preparations that we met, we looked at what lacked in other countries. As I said initially, it's a new disease and we knew nothing about it. So there were no guidelines and no protocols in place, for us to follow management guidelines. There was also we had to worry now about how are we going to separate COVID positive patients from COVID negative patients. We were worried about lack of protective equipment. There was also fear and anxiety among healthcare workers, and there was also a supply shortage of viral kits, etc. And in terms of how we made these preparations, I think importantly, the hospital managers, people in charge, all came together and decided to form WhatsApp groups where pertinent information regarding COVID-19 was discussed. And on these forums, everyone's input was correlated, and then procedures, started to be followed. Management protocols were drawn up. Different sections in the hospitals were designated for COVID positive patients. COVID negative patients were put in different areas. And in doing so, we managed to actually contain the spread of the disease.
Okay, and do you think that adequate awareness was made at the outset of the outbreak by WHO, the World Health Organization, the media, etc., and that South Africa responded timelessly?
Okay, I think in order to answer this question, we just got to look at a few timelines of COVID-19. It was on 31st December 2019 that the WHO was informed of a cluster of pneumonia cases in the city of Wuhan in China. The cause of pneumonia was unknown at the time. It was thought to have originated in the seafood market or the poultry and wildlife markets in Hubei province. On 7th January 2020, a novel coronavirus was identified by Chinese authorities, and it was only then on the 31st of January 2020 that the WHO declared the outbreak to be a public health emergency of international concern. So it's about a month that had passed since cases had started rising in China. Personally, in my opinion, I think that the WHO could have reacted sooner, put the world, on guard much earlier. But I think that South Africa's response was very timely. I think the government of South Africa did a very good job in actually putting the country into lockdown at an early stage, because we had our first case of coronavirus reported on the 5th of March 2020. So the South African who had visited Italy and had come back. And then on the 15th of March, we had gone up to 24 cases. It's on the night of the 15th of March that President Cyril Ramaphosa actually then implemented certain measures to prevent further spread of the disease, like international travel bans, etc., from certain high-risk countries. And on the 27th of March, we had a hard level lockdown. And I think that was quite an adequate response by the government in reducing the spread of the disease. And I think more importantly, by them doing so, have actually reduced quite drastically the number of deaths that would have occurred if we were not in a hard lockdown.
Okay, and over the last few months, we've had some drugs and some vaccines that were tested. Can you give us the latest on the situation of vaccines?
Okay, I'll actually talk about vaccines and drugs. I'll first talk about the drugs quickly. It's a quite comprehensive topic. But currently, more than 150 drugs are being researched in different countries, and most of the existing drugs are being trialed against the virus. The largest trial that is currently occurring in the world is being done by the United Kingdom. It's called Recovery, and they have more than 12,000 patients taking part in the trial. It's actually one of the few trials in the world that has given a definitive view on which drugs do work and which drugs do not work. The World Health Organization is also running the Solidarity trial to assess promising treatments in countries around the world. Multiple pharmaceutical companies are also running trials of their own drugs. Now, three basic approaches are being used for these drugs. It's number one, antiviral drugs that directly affect the coronavirus's ability to thrive inside the body. Then they're looking at drugs that calm the immune system because severe COVID-19 is caused by the patient's own immune systems overreacting and damaging the body. And then the third class of drugs that are being trialed are antibodies that target the virus taken from either the survivor's blood plasma or made in a lab. It's possible that different drugs will work better at different stages, such as antivirals at the beginning and immune drugs later in the later stages of the disease. But combination therapies are also being investigated. It's important to note that the only life-saving drug being tried currently are steroids. Only steroids have been proven to save lives, and the discovery has made a significant breakthrough in the fight against coronavirus. The United Kingdom's recovery trial showed that the steroid dexamethasone cut the risk of death by a third for patients on ventilators and by a fifth for those on oxygen. And further data suggests that the drug hydrocortisone is equally effective too. So how these drugs work, they both calm down the inflammation, which is part of the immune response in the body, which can become damaging in severe cases. And crucially, it's also cheap, which means that it's available all around the world and can be used in poorer countries as well. Other drugs that look promising is the antiviral drug called remdesivir. It was originally developed to treat Ebola. But clinical trials of more than 1,000 people found that it cut the duration of symptoms from 15 days to 11 days. It has not been shown to save lives, but studies are still continuing. It will be very difficult to find remdesivir because the United States has actually bought most of the world's supply of remdesivir. But some of this drug has been donated to South Korea as well. And in terms of other drugs, interferon beta is a protein that the body normally produces to dampen down inflammation. It's also been used for multiple sclerosis. And some companies in the United Kingdom are delivering the drug directly to COVID-19 patients to their lungs using a nebulizer. Initial findings for this drug suggest the treatment cuts the odds of a patient in hospital developing severe diseases, but we do need larger trials for this drug. In terms of HIV drugs that can treat coronavirus, initially a pair of drugs called lopinavir and ritonavir were used, and they were shown that they could, in initial trials, to assist in combating the coronavirus. But the United Kingdom's recovery trial has shown that these drugs are ineffective, and the World Health Organization has actually pulled these drugs from their Solidarity trial. The big controversy is the antimalarials, chloroquine and the related drug hydrochloroquine. They may have antiviral and immune calming properties. And these drugs were thrust into the spotlight largely because of claims made by President Donald Trump and because early lab tests showed that they could inhibit the coronavirus. But the UK's recovery trial, as I said, which is the largest trial being conducted currently, shows that hydroxychloroquine does not work as a treatment for COVID-19, and WHO has actually stopped trialing the drug as well. In terms of blood plasma, people who survive an infection have antibodies in their blood that can attack the virus. Blood plasma, which is the part of the blood which contains the antibodies, can be extracted from those who have recovered and then be given to sick patients as convalescent plasma. It's hoped that transfusing seriously ill patients with the plasma can give struggling immune systems a helping hand. And the US Food and Drug Administration, the FDA, has actually given emergency authorization for the use of plasma to treat coronavirus. In terms of vaccines, these are still undergoing trials. Usually it takes a vaccine many years before it's actually released for consumption to the public. But obviously things are being fast-tracked so that it can assist in combating coronavirus. Russia has actually started trials on humans of their Sputnik 5 virus, but other companies are a bit more skeptical in releasing their vaccine too early. And then just a little word on will we have a cure for coronavirus? You may never get a cure for coronavirus. We don't actually have one for the flu or for the common cold or other similar infections. But there is one treatment, as I said, dexamethasone, that works, and there are others that look promising.
Okay. Do you think we're going to get the second wave very soon of the coronavirus?
I think if people are not responsible, people are not cautious enough, then we're actually going to see what's happening in the Northern Hemisphere currently. Because we're seeing second waves of infections in countries like the United Kingdom, where they've eased restrictions, in countries like Spain, countries like France. So I'm not too sure, and I don't know if there's enough data to prove that weather has to play a part. But I think that if we, as the general population, are not cautious enough, to not heed what the government is saying, ignore all the rules that have been set out for us, we'll definitely see a recurrence and a second wave of infections.
But do you think we will be better prepared this time round? Hospitals won't get filled, ventilators sufficient?
Definitely. I think we've our knowledge of the coronavirus is slowly evolving. We definitely will be more prepared. And just a note on that, when coronavirus when the pandemic first broke out, we weren't sure what we were managing. And if we had a patient, for instance, in respiratory distress, they were rushed to be intubated and ventilated. And what we've learned now is that not all patients need to be intubated, not all patients need to be on ventilators. We can manage these patients in an ICU setup, but perhaps on high flow nasal oxygen, which has been proven to be effective in treating patients. So definitely we'll be much prepared, and I think we'll be able to fight a second wave of infections much better than we did the first time around.
Okay, thank you, Dr. Anil Desai, anesthesiologist from Johannesburg, right here on J-Ho Radio. We now have Dr. Amitabh Mitra. He's an accident and emergency professional at Cecilia Makikwane Hospital in Madatsane. Good evening and welcome to the program, Dr. Mitra. How are you doing?
Thank you very much. Thank you very much, doctors. I'm very happy to be with you today.
Okay, Dr. Mitra, being an accident and emergency professional, would you say that accidents and emergency or casualties were low during the lockdown in South Africa?
I mean to say, during the period of March or April, it was the department, which is actually falls under the Department of Health, was not really prepared. And I think the whole country was not prepared. So we had, the pandemic had a lot of healthcare workers, which includes me. I suffered from COVID. I had to be admitted in the hospital, in the ICU. So it was purely because of poor knowledge and lack of PPEs and protective equipment, and the surge of patients, which was far more than the resources which we have to control them. Although I was working in the trauma sector and I'm the head of the trauma area, I got COVID from a trauma patient. So basically, one cannot sort of divide that this is can be a patient who is having a respiratory problem or a medical problem is possibly more of a COVID patient, or a patient who has come with a fracture of the humerus or a fracture of the lower limbs or a stab injury um, uh, is not having any COVID symptom. So, in the accident and emergency, in the trauma, basically, we were not having the knowledge that these patients whom we are dealing with, the patients who have been stabbed, patients who are involved with motor vehicle accidents, patients who are pedestrian accidents, they're also COVID. And this knowledge we have now, and we are more prepared than before.
Okay, you're also a gender violence expert. So, in simple terms, can you explain what is gender violence and the various types of gender violence? And today is International Gender Violence Day.
Well, I actually was at 1 o'clock this morning in the hospital dealing with a woman who has been sexually violated. So, gender-based violence is now a global affair. It is not based in South Africa, but South Africa leads in the gender violence. Uh, Violence to any gender, but mostly to the female gender, uh, relating to the political situation of socio-political situation of the country and the culture. So remember that in South Africa we have got a patriarchal culture, and that causes far more gender-based violence than any other country of the world. So we have South Africa also feels proud because I am working in this field since 1994. So that was a time when the National Prosecution Authority (NPA) was not even developed. So the NPA was developed, and I have been in the foremost in gender violence, collecting evidences, and appearing in the courts all over South Africa. I think because of my evidence, nearly about more than 2,000 double life sentences have been awarded.
Okay, and what would you say is the main reason for the increase in gender violence stats during the lockdown?
Well, we saw a variety of the gender-based violence is what we call, one is the interpersonal violence, and the other one is an intimate personal violence, and both of them went high during the period of lockdown. And although 48% decrease in the trauma related, that is direct trauma or motor vehicle accidents reduced, but gender violence, which was between due to stress, being locked up in a small place or in a small shack, that was one of the entities which we discovered.
And what advice would you give to someone if we know that someone is being a victim of gender violence?
Beg your pardon?
What should one do if we are aware that someone that we know, being in the neighborhood, family, workplace, whatever, we know that they are a victim of gender violence? How should we react to that? How can we help them?
Well, one has to be very sort of should come out. Um, there is a lot of suspicion and softness in this field. Men involved in gender-based violence and the 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 gay community, they really don't want to report to the police station, or they don't want to come out. So I would say that that even the men should also come out, and the LGBT community, they should also be aware of this, and they should come out. We have got a chain of Tutuzela centers, which is the first of its kind in the world, and which actually is attached to a fast track court. So, if such cases of assaults are reported to us, then we fast track it, and the the person who did it is arrested and is charged very quickly.
Okay. Coming on to another topic off from gender violence now. Many doctors and medical staff lost their lives during the pandemic, and South Africa salutes each and every single essential service worker. However, in your estimation, could more lives be saved?
I mean to say the healthcare workers.
Yeah. Yes.
Well, I would say that the healthcare workers are never safe.
Mm. Is there any precautionary measures that we can take
Well,
to?
with me, where I wa- got COVID-19, and
Mm.
I had to be admitted because my oxygen saturation went down, and all what Dr. Desai was telling me, I was listening quietly. And I was thinking that what he is saying and what I had experienced were so different. So nothing really works. And to be true enough, it is just a matter of, of, of chance of survival. But anybody and everybody is not safe. Previously, there was an element of there was an element of age group. They said that people who are over 50 and who are having comorbidities, they are more. Yes, there are possibilities of, yeah. But even now, the other day, a 25 years old a medical doctor passed away. So the age difference is not really now the matter. It has become far more brutal, the COVID-19. I mean to say, with my personal experience, the COVID-19, which we saw earlier in March, and the one which we are seeing now, today, there's a vast difference. It is far more brutal, and it is far more dangerous, and one has to be very, very extra careful. I use double mask in the hospital. I use complete PPE, but still I know that I'm not safe and my doctors are not safe.
Okay, Dr. Desai, would you like to add anything on that?
Sorry, could you repeat the question, please?
I say, would you like to add anything about how we can prevent medical healthcare workers from being affected from the COVID-19? Any precautionary measures that we can take?
Yeah, well, apart from personal protective equipment, I think just be cognizant that the disease is not gone away. I must say our experience in Gauteng has been much different from the experience in the Eastern Cape. I belong to the South African Society of Anesthesiologists, and just the other day we had a chat to say that a lot more people are going to be dying from other disease than just from COVID-19. People are afraid to come to the hospitals because they fear contracting coronavirus, and they have disease is going to kill them more than COVID-19 is going to do. Must say from my experience in Gauteng, I've heard of horror experiences in the Eastern Cape where I know a lot of these doctors are from. But from our side, we are starting to ease up on a lot of our restrictions in the hospital. However, we all have to wear our personal protective equipment, and we have to wash our hands, sanitize regularly, and move on with life, basically. But I guess if you're not cautious enough, if you're going to be walking around without your personal protective equipment in high risk environments, then you are going to get the disease.
Okay, thank you. Dr. Mitra, the Hindu Dharma also offers alternative healing treatment through systems like Ayurveda. Do you think indigenous knowledge systems in South Africa and systems like Ayurveda could have been introduced earlier, also simultaneously to help ordinary citizens cope during the lockdown to ease the pressure on medical workers?
Well, I believe that is quite true, and we might be able to sort of, although research is not there, but with Ayurveda, I really have got a lot of belief on it, and I don't disagree that it should not be used, and why not? If somebody has got a belief on homeopathy, and there is arsenic homeopathic treatment for this. So I have discussed with homeopaths in India how they are doing it, and Ayurveds. And I mean to say, there is not a treatment, obviously. There is no treatment for a COVID. But to boost up personal immunity towards the virus by any chance, by any means, is what our aim is. The COVID-19, like HIV or hepatitis, is also a virus. But this is a far more furious virus. It is out in the air. It is out as we speak now. And people don't take it seriously. People sit down and think that, okay, when we go out, we will get it. But who knows? Who knows when it is going to get inside the house? So my personal viewpoint is that, as I say, that the COVID-19 is, which we saw before, and the COVID-19 which we are seeing now is far more different than what it had appeared in the South African landscape.
Dr. Mitra, thank you. We will come back to you in a while. We now turn our attention to Dr. Priya Durga. You being a second-year medical intern, you must have felt that you were thrown into the deep end with the pandemic. Am I right?
Yes. I think there's at times where it was very overwhelming, especially during the first few months of the pandemic when, everything started, especially during that lockdown period where the hospitals were now getting ready and sort of going into preparing for the peak of the virus. So at that point, as an intern, we rotated through different departments. At that point, I was in anesthetics. And the anesthetic team, they did some in-house training on how to don and how to doff. So that means to put on the protective equipment and to take out the protective equipment. So, the advantage of being in a state hospital that was closely linked to a tertiary hospital was that we did get a lot of training and we got a lot of knowledge on the first-hand knowledge and first-hand practicals and protocols on how to deal with the virus. But then also as an intern, I think the downside was as a junior doctor, you get thrown into the deep end a lot because you're the one that now gets to do all the work that the senior doctors don't really want to do in a public sector. So that was also a bit of a scary thing. And then also the knowledge of maybe taking it home to family members, which is also quite scary. But on the positive side, it's something that you learn from, something that you grow from. So the experience hasn't been completely negative.
Okay. So how will one know whether they have the flu virus or the coronavirus? I mean, the symptoms are so close.
Yes, it actually is quite difficult considering there's such a overlap in symptoms. But I think from my experience with patients that I've encountered, the most distinct feature or symptom that they had that isn't so common in cold would be your loss of taste and your loss of smell. So a lot of patients had that, and even a very more severe headache than you would get if you had a normal common cold. And then, so that's your more common features. And then there's also the features that sometimes don't present with the ones that you hear about on news. So they may be less common, but they also have a few features that would be like maybe people that are more tired, or if you have comorbidities, then they'll have an increase in their blood sugar, for example, if they've got diabetes. So I think it's just be cautious, be vigilant, and know that if you've been in contact with someone that may have had coronavirus, have a high index of suspicion.
Okay, so many people have done the tests. So if your tests are negative, it does not mean that you won't get the virus, correct?
Yes. So just because you have a negative test, it could mean different things. Either you got tested when you were asymptomatic and the virus is what we call not shedding, so you won't actually get a positive test, or you have a false negative, which in that case you may have an underlying virus, but you not necessarily you have a positive test result. So it's just, like I said, you have to be cautious. And even if and then there's also been cases where we've heard about a reinfection, or maybe there isn't a reinfection. So even if you've had the virus before, or you've been negative before, you can just be cautious of a possible reinfection or a possible infection that comes after your symptoms.
So when should I go for another test?
So the best time to go for a test would be when you are symptomatic. And if you've had maybe a positive contact, then, if you've got any symptoms of COVID, or if you've been in contact with someone, that would be the best time to actually go for a test. It's also important to note that if you have had a positive test before, it's not necessarily important for you to go get another test to prove that you're not negative.
And how will one know that they need to be admitted to a hospital?
So when you need to be admitted to the hospital, maybe when you have there's difficulty breathing, if you do have a SATS monitor at home and you see that your SATS is dropping to something below 80. But yes, if you have any difficulty breathing, if you're having any symptoms that is a lot more severe, that you feel like you cannot handle it at home, that would be the best time to seek hospital care.
Okay. And what tips can you suggest that one should follow to stay healthy during the pandemic?
So I think it's very good to keep up to date with your vitamins. So your vitamin C, vitamin D, zinc, thiamine. Obviously, please contact your local GP to make sure that they don't coincide with any of your chronic medications if you are on any. And then also, I think practices as the government has put back. So your social distancing, wearing a mask is important. Washing your hands, sterilizing, well, sanitizing your hands with alcohol if you on a regular basis. All of those just because, and keeping a social distance. I think even though it's level 1 now and a lot of things have opened up, just be cautious, just be vigilant, just keep up to date and, keep thinking that, don't think that the virus has gone away just yet.
Okay. We now turn our attention to Dr. Piyasha Pillai. She's a dentist here, a general dentist. So, being in the dental field, Dr. Pillai, it must have been very scary, especially when the public is told to wear masks. But in order for you to do your job, patients have to take their mask off. Share your experience of the situation.
Namaste, and thanks for having me. Initially, it was scary because it's daunting knowing we didn't know enough about the virus. But we've always had to wear masks, and I think we just followed the guidelines that were given to us to wear our PPE properly. If we were doing any aerosol generating procedures, we would have to use, which is like fillings and cleanings and things, we would have to use an N95 mask, which filters out 95% of the viral particles, and on top of that, all our other PPE and a shield. So it lowers the risk a lot of getting any cross contamination. And then also at our practice, like probably most dental practices, we have strict protocols for patients, So it works mainly on appointment basis only unless there's an emergency. You make your appointment, you come in, you fill in a COVID form, they test your temperature. We ask the patients that if they're not feeling well in the morning of the appointment, they'd rather postpone their appointments until they're feeling better. And then after they've filled in all their forms, we ask them to wait in their car again or in a designated area we have outside until we're ready to see them. That just minimizes contact with other patients or with the staff as well. And then by the time they come to us, our assistant goes and fetches them from the car and they come straight into the surgery. So it's minimized. And then at that time, we have all our PPE on. So the load is much lower. Yeah, so
Okay.
it's been getting easier.
All right. And what other challenges has this pandemic caused for the dental practitioners?
Also, initially, when it started in level 5, PPE's prices just skyrocketed, which was very difficult for private practitioners, I think, because we had to buy our own PPE and the stocks were low as well. So that was one difficult thing. Another difficult thing is in level 5, we weren't actually allowed to do any routine treatment. We were only allowed to see emergencies. So no routine treatment, no fillings, no cleanings, no anything like that. So what happens is if you have a small little cavity in March, by the time it reaches September, 6 months later, it's a bigger cavity requiring much more extensive treatment, which costs more. And coupled with that is the fact that so many people weren't able to work, they lost their jobs. The first thing they do is cancel their medical aid. So we're sitting with a problem where people need extensive work that costs so much and they don't have the funds to do it, So it has been challenging where you have to now decide what minimal treatment you can do to help the patient until they can afford treatment and things like that.
Okay, so there's been a lot of false information that has been lurking on social media. Can you mention some of them and rectify these false news?
It's difficult. I don't really get involved in much debates or arguments online, but what I can say is that, people should try and make sure their sources are reputable before they share or use it in practice. I think we have a responsibility to educate our patients, and guide them. An example I have is a patient came in and she said that she eats a raw onion every day to prevent her from getting the virus. And I think as much as it's good to have immune boosters and all that to, improve your health, it's not going to prevent you from getting the virus. You still have to practice the basics and stick to what you know. Wash your hands, social distance, sanitize, use your mask all the time. And that's what's, just be responsible, and that's what's going to keep you safe. And just make sure what you're reading on social media is reputable, and you get advice about it before you just believe it.
Okay, thanks. So we've got some questions from our viewers and listeners now. So I can pose it to the panel. Anyone wants to take the question, you're welcome to do so. So the first one, I think maybe Dr. Desai can do this one. Is the vaccine coming by March 2021? And that question is from Lakshman Vishnu Maharaj.
As I said previously, when vaccines are developed, it takes years and years and years of trials before the vaccine is released for public consumption. There has been political pressure from a lot of governments to actually fast track it, and there's a competition at the moment, to see who comes up with the vaccine first. I think for his election prospects, Donald Trump is trying to get the vaccine out before November 3rd. It's difficult for me to say whether a vaccine is going to be available by March 2021. But I saw that the United States company, the company where the company Moderna that is developing a vaccine for the United States, said that it will only be possible for a vaccine to come out by March 2021 in the United States. So it's a very difficult question to answer, but hopefully when a vaccine does come out, it's safe and effective to use, and it achieves the purpose that it's designed for.
Okay, I think that's maybe another one for you. It's also from Lakshman Vishnu Maharaj. Why is infection and death rates less in rest of Africa versus South Africa and rest of the world? Is there a high immunity level in the rest of Africa?
All right. Firstly, just to answer this question, we in Africa are not as well resourced as some of the other countries. So other countries are able to collect data much more efficiently than Africa is. So we may have a high death rate in Africa, and it's not recorded, or people do not have access to healthcare facilities. So they may be COVID positive, are dying from coronavirus disease, but do not present themselves in the hospital where these figures can all be correlated. So that could be a reason. But if we take it as face value that the death rate is definitely lower in Africa than the rest of the world, then it could be because of the circumstances that Africa finds itself in. We have a hard life here in Africa compared to other developed countries, and our bodies may be more resilient, so we may be able to tolerate the virus better than some of the older population that live in the other countries.
Okay. The next question is from Yashika Singh. So anyone in the panel want to take it, may. And her question is, how can countries like India assist if a vaccine is found? Dr. Amitabh, you want to take a go with it?
Yes, thank you very much. When it comes to vaccine, obviously, the Russian vaccine is the first one which has come out, and it has been taken over by Bharat vaccines in India, and they are actually starting to use it. But the Indian Council of Medical Research has already on the third trial of that, and the final trial of the Indian vaccine, and that should be out by any time. So any vaccine or any, I mean to say, any drug manufactured in India comes to South Africa very quickly because of a wonderful relationship between India and South Africa. We have to remember that during the period of the HIV pandemic, South Africa to depend on the US, and each of these AZT and 3TC were so expensive that South Africa was not able to afford it. It was India only who assisted in giving very cheap at manufacturing rates. And today what we see, the antiviral drugs are available, actually Indian made to South Africa. So vaccines made in India would be available to South Africa immediately.
Okay, Dr. Desai, I think this is another one for you. Question coming in from Lakshman Vishnu Maharaj once again. People that recover from COVID seem to suffer from blood clots and other complications. Why does virus cause such other problems?
Well, as I said, as I alluded to earlier, this virus is a novel virus. As each day passes, we are learning more and more about it. And initially, it was started as a respiratory virus. But what postmortems have shown is that patients who actually develop the severe form of the disease have blood clots in their system. So it's rather than the lungs itself being affected, but you get thrombus. Thrombus means clot formation in the pulmonary vasculature. So it's not patients who have recovered from COVID that actually develop these problems, but patients who are actually in the middle of the disease, so basically they are experiencing COVID-19 while they're in hospital, are experiencing these problems already. And we still have a lot to learn about this virus. I cannot actually tell you why this virus causes such problems. But it's not only the respiratory system, the vascular system that's affected. Studies are now showing that a lot of patients are developing neurological problems, even if they were asymptomatic when they tested positive for COVID-19. So, and also a lot of patients manifest with strokes, cardiovascular accidents, myocardial infarctions, heart attacks. So if it's a totally wrong concept if you believe that you will only develop respiratory symptoms when you have COVID-19. It affects most of the organ systems in the body. Why? We're not sure.
Okay, we have a comment and a question now from Irashan Surban. He says, Namaste. Firstly, I would like to thank all the medical practitioners out of this for their service and dedication. So us during this period, you are all greatly appreciated. There have been a few medical practitioners' deaths from the community in serving during this period. Our prayers and condolences are with their families. And the question he poses now, anyone in the panel welcome to answer. How are medical practitioners handling the stressful period, long hours, and in hazardous conditions? Does meditation help reduce the stress?
Dr. Mitra would like to answer.
Okay, Dr. Mitra.
Thank you very much. Long hours, yes. I was there in the hospital since till 2 o'clock this morning. Came back home. So meditation, if one does know how to do it the proper way, and Guruji can teach, that is one of the greatest factor, and I would strongly recommend doctors to do that. For me, I'm a visual artist, And if I can pan it on to you on that side, you'll see some of my works there. I exhibit my paintings all over the world, uh, and I have a show going on now. Other than medicine, when I come back, I start working on my artwork, and that is a release. That's a catharsis for me. So I think everybody should have an alternative way to medicine is not the only profession which we should follow. We should also think of alternative means, writing, literature, reading, poetry, writing poetry. Those are excellent ways. During my period of isolation and ICU care in the hospital, I had to deal by writing within because there was nobody there to look up to whom I could talk to. So the only way I survived those days was just by writing of what I am feeling and how I am going to go through it. I think those are the things which are cathartic.
Okay, we have another question from Irshan Surban. There is evidence that the virus and other recent pandemics like the N1H1, SARS was transferred from other species to humans. Hinduism recommends a vegetarian diet. If the world stops eating meat, will this prevent or greatly reduce the world from suffering like this again? Should we promote a vegetarian diet?
I think promoting a healthy diet definitely assist in reducing morbidity and mortality, not just from COVID-19 but from many other diseases. But whoever can promote a vegetarian diet and achieve that, it would be a real accomplishment, because there are many people who would be totally against that.
Okay, we've come to the end of the program, so I must thank each and every one of you to take time off from your hectic schedule and bring the Corona warriors. So thank you once again. Any parting shots from each of you? We'll start with Dr. Amitabh Mitra. Final words from you.
Very much. As I had told the Doordarshan TV channel in India, that the first thing which every person, whether it is a healthcare worker, a healthcare survivor, or a close group of friends, one must relate the message that please take this pandemic or the disease seriously, and don't take it lightly. Don't just say that, okay, the graph is plateauing or it is no longer peaking, so I could go out and sort of enjoy myself. That is not the way. This virus is here to stay for another 2, 3, 4, 5 years. So you could, or anybody could be the next victim, as I had been the victim of this virus. So take it very, very seriously. And the second most is obviously mask, as everybody in the panel had mentioned about. I would actually, for our healthcare workers, I would say taking double mask is essential. Gloves, double gloves, PPE, goggles, and that is what would probably assist us in our professional sector. And I would suggest that please be careful and just don't risk yourself without sanitization or whatever.
Okay, thank you, Dr. Mitra. Dr. Priya Durga, final words from you.
Yes, first of all, thank you so much for having me. Just be safe, be vigilant, take all your precautions, and don't seek help when you need to.
Dr. Anil Desai, final words from you.
Okay, I'd like to echo what Dr. Mitra said. I'd like to echo his sentiments, and that is not to take COVID-19 lightly. Yes, we have managed in South Africa to keep our mortality rates low compared to other countries. But some other countries in the Northern Hemisphere, there's always a possibility of a second and a more severe infection wave. So we do not need to put life on hold, but we need to be cautious, and we need to adapt to a new way of living. Things are not going to get back to where things were pre-COVID-19. So in essence, minimize your social interaction with people, wear masks, wash your hands regularly, eat healthy, and don't forget to pray.
Yeah, it's certainly a new normal we're living now. Final words from you, Dr. Piyasha Pillay.
Just thanks again for having me. And I think with what everyone else said, just continue to do what you're doing and don't think the virus has gone away. And also just take this time now to cherish the time you have, the time that you can spend with your family now. Try not to focus so much, be vigilant, but don't focus on the negative. Try to focus on the positives and the things you can do, and just cherish your time that you have and enjoy it as much as you can. Thank you. All the
Okay,
best.
thank you. Ladies and gentlemen, may you continue to do the great work you are doing, our warriors for Corona. Everything of the best, and thank you once again for your time.
Thank you very much.
Thank you.
Thank you, sir.